I describe myself as being an advocate for the patient. So I am there to act on their behalf, but also to provide them with assurance that someone on the inside of the organisation is looking after their interests. So whilst I have been involved with dealing with issues that people have got, it's also about being the conscience of the organisation about, are you listening to the patient? Have you asked the patient? Do you know how to ask the patient? Because I can assist you with that methodology if you need it. So it's about kind of having a foot in both camps. I think it really started when I was still working in public health, and we had to produce a health improvement programme. So this was much more stakeholder engagement at this time. So it was around getting all of the statutory and voluntary organisations that were working in that borough council area to identify what the issues were for them and to come together for one programme that would assist all of us to create a healthier community. There were some people who would have been doing community work, much more in the local authority than in health at that time. The health improvement programme was the first time that we'd reached out and worked in a multi-agency way with a range of different providers, but we still weren't really talking to individuals, to patients at that time, or to the public per se. The health panel is all of the people who have said they want to work with us. So they might sit on primary care development group, they might sit on a focus group. So we decided that we would set up a small group of people who did meet together. So 13 people who met together on a monthly basis with no fixed agenda except to be a sounding board for the clinical commissioning group to be able to take issues to it. When I had to describe this to staff, there was an advertisement around at the time for a certain bank which wanted to make its staff accessible. And the advertisement was that you were looking at a household and the mother of the household went to a cupboard, opened the cupboard, and there in the cupboard was the bank manager, showing how accessible they were. So I used to call the health panel my patients in a cupboard to try and explain to staff that we had them, that they could access them, that, you know, they just had to come through me and we would find somebody who'd got experience or whatever it might be. If somebody wants to get involved with the engagement activities that any NHS organisation is setting up, they would look on the website of that organisation. There'll definitely be ways that they can get involved then. I think the health panel have always surprised me. As well as getting the ideas from people, it's a brilliant way of being able to identify whether what we believe happens on the ground is actually happening or not. If somebody wants to get involved with the engagement activities that any NHS organisation is setting up, they would look on the website of that organisation. There'll definitely be ways that they can get involved then. I suppose there's two things that I'd say. The first one, which is around setting it up and getting it running, is that there's this quite difficult balance between needing to have the patient stories in order to have examples of where things are going really well that you want to roll out, or where things could be improved. You need those. You can't just talk in theoretical terms all the time. but not letting the patient stories be just the platform that everyone uses to come along. My auntie went in and this happened. Oh, well, this happened to my neighbour, and oh, well, I know somebody. And it can just become a whole series of stories, and actually you never do anything with them. I'm aware that the lay reference group was once described as being like presenting to 13 Pam Purdues. I take that as a compliment. The group is there to be a critical friend, and so they don't pull any punches. They listen. If they don't like things, they'll share that. And that can be quite intimidating for somebody who's perhaps not used to that kind of response. So you have to be prepared that you are going to incur their wrath if you're sharing something that they don't particularly like. But it's only by doing that that we actually improve things. I would say initially it was very patchy, so some people were doing it, some weren't. Then it moved to, well, there's legislation's come in and we've got to do it. So we're doing it because there's a law and we've got to provide evidence that we're doing it. Then it moved to, actually, doing it's quite good because we're getting a lot of feedback and that's really helping us. And now I think we would be hard pushed to find any member of staff in North Derbyshire Clinical Commissioning Group who didn't understand public engagement, was using it as part of their work and benefiting from it as well. The first thing I would say that it's got to continue to respect patients and the public. I have the greatest respect for clinicians. They've got an incredible amount of knowledge, of experience. We need their input in order to be able to plan services, but they're one side of the picture. The people who experiences those services is the only person who can say what it's like to experience them. No GP can say what it's like to be a patient in their own GP practice. They have no idea. They don't have to make a telephone call at 7:30 in the morning to try and make an appointment for that day. So we've got to respect the value that those people bring, and we've got to use that. We've got to feed back to them what it is that they've told us. We've got to tell them what we've done based on what they've told us, because I think it's only by recognising that people need to be kept informed that they will start to believe us, trust us, work with us, understand if we get things wrong, and just be a partner with us in moving forward. I think there are probably two things that will be developed in the future. The first one is seeing the patient as someone who has control over their own condition. So empowering them to be able to self-manage, empowering them to be able to get the information that they need to be able to self-manage. We know that in the new NHS, with the challenges that we've got with the finances, we need people to be able to manage independently for as long as possible. So I think we need to be working with people to allow them to be able to do that and to equip them with either the skills or the resources that they would need to be able to do that. I think the second area for me is the area of patient participation groups. I think in the future, patient participation groups are going to be the route to the wider GP practice population. They'll have a role to educate their peers, to act as advocates for their peers with the practice. And I think it's a huge area that can be developed and probably will be developed. I'd magically make every frontline member of staff have the right attitude towards patients. We can have all the policies in the world, we can have all the programs, we can have all the right motivations, but if somebody doesn't look up from the desk when you go up to reception because they're not respecting you being there, or if somebody takes your blood without engaging you in conversation in any way, shape or form, I think that sets the tone for your whole interaction with the NHS. Every time somebody asks me what I'm doing in retirement, I say nothing. And when I've said nothing, the answer is the same every time. I can't believe you're not going to do anything. So initially, I am going to do nothing. But I would very much like to get involved in some projects near me, Transition Town, which is around communities reducing their carbon footprint. So things like allotments, community gardens, sharing, using food that's come from supermarkets, that's fresh food that can't be sold, but can't be given to food banks because it won't last. So that's used to cook meals. The meals are then sold to the community and the money is then used to give to the food bank. So those kind of projects I'd like to get involved in. And I'd also like to use my English as a second language skill that I got through VSO. And I've been involved with a project in Nepal, which is empowering village women in Nepal to become porters for people trekking, but they need good English in order to be able to do that. So I'd like to get involved with that charity as well and do some teaching of English as a second language to those.